According to the World Health Organization, there are 10.3 million women who are at risk of developing cervical cancer. Every year, approximately 2,400 women are diagnosed with cervical cancer, and 1,700 of those die, the largest proportion of deaths concentrated in Nairobi, making early diagnosis paramount. The long queues at KICC during the recent cancer screening perhaps justifies the figures.
Now, as you can see, most of our work happens here. This is Dr. Ronit Sliper. She is our senior engineer.
It is these startling numbers that led a group of young scientists in Israel to start cracking their heads. A tiny device that can detect early signs of cancer came to life this year after 2 years of trial and error.
So we began with Dr. David Levitz's work on thinking about polarization difference imaging. And so this first prototype in April 2013 was using 2 cameras in order to capture different ways of light. And then we continued on to develop that so that it worked on a phone. And we realized in April 2014 that the most important thing was something that would be handheld, so you can use it wherever you are. And we developed that further and built a prototype that nobody liked. And then we finally built a prototype that they did like, which also enabled for oral cancer screening. And we combined those two into this type of prototype, which ended up being what we're now selling around the world.
Unlike pap smears, Mobile ODT, an Israeli technology company, developed a more advanced visual assessment system that is non-invasive and which uses digital and regular magnification spectrums to detect suspect tumors in a patient.
Now, what this device does is very simple. Just like you all with your phones are able to take pictures, we use our special application on the phone. So I can take the phone and put it in my pocket. I can use my personal phone, put it in. Every person has their own user account. They can see through the account, through the screen, who the patients are. They can then screen those patients so they can track information. They can view the cervix with up to 32 times of magnification. They can capture images so they can send it to doctors or to others who can help them to make the decisions. And then they can track whether that woman needs to go for screening and treatment elsewhere. And so using our system with it has a bright light and it has a lens tube for added focus, we're able to help enhance what people see. And so this is called the Enhanced Visual Assessment System, or EVA system, EVA.
Once those images are captured, not only can the health provider look and see better the cervix, she can transfer the images online to ask for support from a peer.
Well, instead of a woman having to come into the clinic, now a nurse who's screening someone at the private clinic can send the images to the gynecologist who can review and say yay, nay, yeah, and how they should be treated. And so it can save a lot of time and a lot of money for the county when it's conducting its screenings.
So it just sort of focuses on this?
That's right.
The firm conducted trials in 15 counties, and out of those, 9 have already acquired the device after the FDA approval in June this year, among them Kenya.
Well, the first county that we've been partnering with is Meru County, so Dr. Mura at Meru County, and we're hoping to deploy 50 devices with them in 46 different clinics throughout the county at levels 2, 3, 4, and then finally at the level 5 facility that they have. 2 other counties that we've been in conversation with are Laikipia and Muranga.
The mobile coloscope has been a success story in rural areas where access to screening is nearly impossible, and it is slowly changing lives there.
This device was created for the rural areas. You can see it's something that I can carry around like a bag. It's portable, it's durable, you can drop it and it'll be fine. It has a light source that's very powerful and rechargeable in the same way that you would charge your phone. So the same charger you use for your phone, you use right here for the device.
That success played out during the recent screening of cancer in Nairobi, although still on a small scale and in a few private hospitals. Health providers will tell you it has changed the perception of many women who more often than not are afraid of screening.
It has brought the cost down considerably, yeah. From something that might cost over 1,000 shillings to less than 200 or so, that's a big improvement.
Pamela Sigi, NTV.